Good day, dear students. Today we are going to discuss infection prevention in healthcare, the basic practices. As you can see in the title slide, you are being shown a ICU, or I would say a hospital ward, which is an indication that we are discussing about something related to healthcare institutes. Now, when we studied about nosocomial infection, that was basically, as I had explained to you, the infections which have been acquired from hospital. These are known as hospital acquired infections or nosocomial infections. And a very large percentage of infections are due to the infections occurring from healthcare institutes, that is clinics, hospitals, or other setups. So we want to prevent those things because it unnecessarily prolongs the stay of the patient in the hospital. He suffers agony, pain, as well as there is also a huge financial burden occurring to the patient. And therefore, none of these things are desirable. Hence, utmost care has to be taken to prevent infections which occurs from healthcare institutes. What are the basic practices which one should follow to prevent such infections? So that is our topic of discussion. Nurse's role in infection control. This will be our coming lecture, that is next lecture, that we are going to discuss these things in detail. But the three basic important roles which nursing personnelists, or for that matter any person associated working in hospital associated with the healthcare practices should follow. First one, correct sterilization, disinfection and sterilization procedures. He or she should make the patient thoroughly about the infection as well as the basics of disease prevention. Because the patient who is being admitted in a hospital is unaware of infections or any knowledge regarding infection and its prevention. Third important thing is nursing personnel should administer immunization programs and educate the persons during their stay in hospitals or in some camps or in a society wherever possible. So these are basically the primary role of nursing personnel. Well, we are going to discuss these things in detail in our next lecture. Now, to understand the basics of infection control practices, there are three levels where infection control can be practiced, and that includes sanitation, disinfection, and sterilization. Basically, in our previous lectures, we discussed in detail regarding disease cycle, and in that we also studied about infectious chain. There are 6 links which completes the disease cycle, and this is what each and every pathogen would follow in order to propagate themselves, and that is known as disease cycle. What are those? To remind you about that in short, it includes the source of infections, that is, it can be the individual or the reservoir. Then the modes of transmission, how it can be transmitted from different sources by air, food, water, direct contact, etc. Portal of exit, how these incident, that is the pathogenic organisms, would be transferred from the infected individual to the diseased individual. So portal of exit, then portal of entry, and ultimately this also includes other environmental factors as well as the host resistance. Now, if we break any link in this cycle, in this chain, naturally the infections can be brought under control. And during epidemic, like as we have suffered in the past 2.5 years regarding coronavirus, if this chain is broken, any of these link is broken, then the disease or this pandemic disease can be brought into control. So what are these 3 levels of infection control as far as hospital practices are concerned, as far as the control of infection in hospital can be done? First, as I have told you, is sanitation. So what is sanitation? Sanitation is, in general, you can say, good hygienic practices. Cleaning and scrubbing of instruments, that is, you can say, washing them properly, scrubbing them properly so as to remove any dirt from these instruments or equipments, and any contamination has to be disposed of. It is to be removed, and this contaminant includes microorganisms. So that is sanitation. Second one is disinfection. The second level, which is used on instruments and equipments, is to be disinfected. All instruments and equipments which comes in contact with the intact mucous membrane have to be disinfected. Disinfectants are very many, and one can use any one of them which is able to kill the microorganism but should not injure the host if at all it comes in contact with it. Normally, disinfection is the word which we use to sanitize non-living materials, including instruments, equipments, as well as the environment, like say floors, and the scrubbing of, or I would say washing and disinfecting the environment with window panels and other things. Next, third in line is sterilization. What is sterilization? as the definition runs, it is a complete destruction of any kind of life, including microorganisms like bacteria, fungi, virus, and even spores. So, getting rid of any form of life from that equipment, instrument, is known as sterilization. We are getting rid of microorganisms in the vicinity of that particular instrument. So, here sterilization is a third step, and this would ensure the complete removal of microorganisms. One thing one has to understand is it removes pathogenic as well as certain beneficial microorganisms too. So these are the 3 levels of infection control. Now, what is included in sanitization methods? The first step is collecting the instruments and placing them in a container with water and neutral pH detergents until you can get to them. It means these instruments, they have to be placed in a container having certain amount of water with neutral pH detergents, and one has to use utility gloves every time they pick up an instrument or equipment. They should use mask as well as eye protection, as well as the protective clothing, that is PPE kit, if blood, body fluid or other tissues are also present. The sanitation methods is followed in this particular sequence. Drain the disinfectant or the detergent solution, because as discussed earlier, these instruments are kept in a container having disinfectant. So when you pick it up by wearing a gloves, sterile gloves, drain that disinfectant or a detergent solution. First is draining. Second, rinse each piece under hot running water so as to remove any traces of detergent solution. Then scrub these instruments, each and every item, using hot soapy water and small plastic brush. So scrubbing has to be very thorough from every nooks and corners of the instrument, because that is the place where, if at all there is a contamination, the detergents or the scrubbing may not be able to reach to that site. So you have to take care that scrubbing has to be exclusive or very thorough. As I told you, nooks and corner basically includes hinges, ratchets and nooks. Then in sanitation, we also used to have, or we should have, standard precautions to all patients. All patients have to be applied with certain standard precautions, regardless of their diagnosis, and to all contaminated equipments and materials. No patient, no disease, no infection should be taken lightly. So, standard precautions have to be applied to all patients regardless of their diagnosis of the disease. And another one is the use judgment in determining which protective barriers are necessary. So that is what we call a common sense. So, our experienced or well-read nursing staff or the staff associated with the healthcare practices, including physicians and doctors, should use judgment in determining which protective barriers are necessary for prevention of infections. Next comes sanitization methods. In this, as we should do, what we should do is rinse instruments individually and place each one of them on a clean towel, followed by rolling all instruments in the towel to remove moisture. And these instruments are either placed in trays or bins for storage, or they should be wrapped for sterilization. They should be stored in a clean container, either in trays or in bins, till they are to be taken for sterilization. And whenever they are to be taken for sterilization, they should be wrapped in wrapping paper. Now coming to disinfections. Here, one has to wear gloves when handling the instruments. Disinfection solution must cover every surface, and disinfection is used if instruments does not penetrate a patient's skin or mucous membrane. Normally, as I have discussed or told you just now, that disinfection is normally carried out for non-living materials. But if it does not penetrate patient's skin or mucous membranes, then that disinfections can also be used for human beings. Examples are animal wares, endotracheal tubes, glasswares, or laryngoscopes and nasal spatula. All these instruments can be disinfected before its use, because if these instruments should be taken care of and can be disinfected by using some chemicals, disinfections, as long as it does not penetrate the patient's skin or mucous membranes. Now, during standard precautions, one should use, first is a proper hands hygiene, and the second one is use of personal protective equipments, PPE, personal protective equipments. Personal protective equipments includes gloves, gowns, that is aprons, masks, eye protection, as well as field shield, that is face shield, which covers the entire face. And even if a person is wearing a mask, it is preferable for healthcare workers to use shield for preventing respiratory droplet transmission. Needles and other sharp materials like knife, spatula, scissors, scalpels, all these things, including needles, they should be put in a sharp containers. Special containers have to be designated for them. So it is in these containers that needles and other sharps should be discarded and must be located as close as possible to the area of use. You don't have to keep it at a distant places. Otherwise, you may have to carry it till them or in a different rooms. So keep it location as close to as possible where we are going to use it. Never ever recap needles. As far as possible, do not try to recap needles. And if at all it is necessary, use the scoop method, that is one hand. Do not touch the cap with the other hand. So always use scoop method, that is the one hand method. This is how it is done. With the help of one hand, you have to add or you have to put the needle in a cap. This is a diagram which shows that you should never recap the needle which you are likely to injure, because while collecting the blood or whenever there is a very sharp object including needle, it may damage your hands, even if you are wearing gloves. These sharp containers in which you have placed sharp objects should be easily accessible. They should be at or below the level of the eyes. They should be kept away from the pathway so that it is not doing any obstructions for the movement. Should not be kept on the grounds and should not be overfilled more than 3/4 of its volume. And lastly, never should be shaken to get more space. So when you fill it up with 3/4 of the container, then you should empty it out or should be discarded. So you should never shake so that you can accommodate more amount of the sharpness. Now coming to cleaning of spills. What is spills? Spills are any material which has accidentally spilled on the bed sheets, beds, ground, floor, wherever it is, or even sometimes some bottles in refrigerator, or during any taste, whenever something is broken in an instrument, that is also a part of a spill. So how do we go for cleaning the spills? For example, blood and body fluids specifically have to be discussed separately, because these are the spills which requires special attention, as it may be potentially dangerous since it may carry an infectious agent. So first thing is, do the procedures by wearing gloves and other PPE kits. First is absorption. Wipe up the spill with an absorbent towel. So first one is to absorb whatever is spilled. You don't have to wipe them directly, because unless and until the material is absorbed, it is possible that it may spill over. If you directly wipe, it may spill over the wider area. So first is wipe up the spill with an absorbent towel and clean with detergent. After absorbing and cleaning with detergent, one should apply a disinfectant to the site where the spillage has occurred, that is, to a possible contaminated area, by using sodium hypochlorite solution, that is Clorox 1:10 dilution. 1 volume of the solution plus 9 volume of water, and the contact time should be 5 to 10 minutes minimum. From that, absorb the Clorox and wash with water. So, whenever the spillage occurs, one should follow these guidelines. Next comes the most important point, which is responsible for the most primary point, which is responsible for the spread of infection in hospital, is through hands, contaminated hands. You must be aware about our initial lectures that Semmelweis was the first person to advocate the washing of hands with disinfectants, because he observed several deaths due to examining the patients by physicians using a contaminated hands. So one patient who was examined, followed by the next, during this examination of the second person, in those days before, say I am talking about 150 to 200 years back, the doctors did not have, physicians did not have, or they did not realize the importance of washing. As a result, the second person who was examined would be getting a contamination or the pathogen transmitted from first to the second patient. Likewise, several patients were examined in row over a period of short time, and hence this would lead to contamination of wounds as well as the problems in childbirth, puerperal fever. This practice was discontinued once the number of cases started reducing, when physicians started washing their hands with disinfectants. So, hand hygiene, the point is that hand hygiene is of paramount importance. One should always use alcohol-based rub. Always remember that use of gloves does not replace hand washing. This is a very important thing. You may use the gloves thinking that you do not require a hand washing. That is entirely a wrong concept, because of a primary important mantra, that is, use of gloves does not replace hand washing. So hand washing is first and primary important thing. Another thing is, these gloves which are being used must be changed in between patients. From patient to patient, the gloves have to be changed before examination. Now, the question arises, when to wash your hands? First, if the hands are visibly dirty, it needs washing your hands. Second, soiled hands with blood or body fluids. Your hands, if they are soiled, if they are having any contamination with blood or the body fluid of suspected patient. And the third is, after contact with blood, body fluids or secretions or even mucous membranes. So, hands, if they are soiled, they are to be washed, but even if you touch and the hands are not soiled, but if you touch any of these secretions, body fluids, blood or mucous membranes of an infected patient, it calls for hand washing. Next is, after contact with intact or non-intact skin. It means even if you are examining an intact skin which may not show any wounds or any infections, But since you have touched that skin, there can be a presence of normal flora on the skin which may act as an opportunist pathogen in the next patient. So, after contact with intact skin or a non-intact skin, your hands must be washed. Next is after handling items which are potentially contaminated, that is the equipments which are there in the hospital setup. In between patients, very clear that when you examine one after the another, your hands has to be clean. After removing the gloves, once you are done with your work, when you remove the gloves, you have to wash your hands. And last but not least is after using the bathroom, one has to wash their hands. It should be used. Now suppose these are the things when it seems that you have come into contact, but not only that, you have to wash your hands before direct contact with patient. Before direct contact, before donning gloves, means before using the sterile gloves, before wearing the sterile gloves on your hands have to be washed. Before preparing or handling medications, because medications which you give to the doctor, that is injections or any other sterile equipments which you put it in patient's body. So before preparing or handling medications. And last but not the least is before handling clean dressings. These are the things which have to be taken into considerations whenever you wash hands. In short, forget about each and every rules and regulations, forget about each of these conditions. The most important and one thing that is to be remembered is wash your hands frequently as and when necessary. Now next is when to use alcohol based hand rub. What are rubs? Rubs are something which are to be rubbed on the skin surface, on the palm, in the hands. So you take few drops, few ml of that solution and you have to rub them thoroughly on the palm, on the forearm here, in the interspaces of your fingers as well as your thumbs. So you can use alcohol based hand rubs. First, if the hands are thoroughly cleaned, they are not soiled, then you can go for using the alcohol based rubs. So remember that your hands are not visibly soiled. If a physician in his hurry, then and it seems that his hands are not soiled by anything, that is in the beginning of the day or wherever it is, then they can directly, without washing, they have to use the alcohol based rubs and thoroughly use it over the entire surface of the hand. This can be done if the hands are visibly soiled, that is contaminated, and then they are washed. After they are washed, you have to use alcohol based rubs. Now coming to PPE, that is personal protective equipments. As the name indicates, PPE stands for personal protective equipments, means they are concerned with the person of that individual. That individual personal body parts have to be covered, and that mainly includes first gloves, second eye shields, that includes goggles or the glass shields, it includes mask, as well as it includes the apron or the gown. So, gloves donning and removal, other PPE kit donning and removal. Donning means wearing or using that, preparing yourself while using the gloves. Donning and removal of N95 mask. Now the next is transmission-based precautions. What transmission-based precautions have to be used? These things are used in addition to standard precautions for the specified patients. This is additional, remember. The basic procedures are always there. But in addition to that, you have to use these transmission-based precautions in addition to standard precautions. And these are basically designated for the care of the patients known or suspected to be infected by epidemiologically important pathogens which can spread by air, that is airborne, droplet or contact transmission. The best example is the prevalent epidemiological disease of coronavirus. So, the routine precautions, they are in order, they are in practice, but it calls for an additional precautions for such patients who are suffering from, who are thought to be infected with epidemiologically important pathogens like coronavirus, which spreads by airborne or droplet infections or by contact transmission. Now you may think, what kind of droplet precautions are necessary? Then the answer to this is, droplets, as you must be knowing by now, we have discussed in previous lectures, that whenever a person is coughing, talking, singing or sneezing, vast numbers of droplets comes out from the mouth, even during the normal talking also. You may not feel it, you may not see those visible drops because they are too small, but they are expelled from your mouth. And many of these droplets, those which are dry, which are heavy, would settle down at the bottom, contaminating the floor or the table or the inanimate objects surrounding the patient. Second, if these droplets are very small in size, they would dry up before they reach to the floor and would remain in environment as in a form of small droplets or droplet nuclei. One thing you have to remember is, these things which has come out from the mouth in form of a droplets are not basically water alone. It contains saliva, it contains mucus and a pathogen. So saliva and mucus and other things, they form a coating surrounding a pathogen. Pathogen in the center surrounded by saliva or a mucus coating. It imparts a kind of a resistance to the organism. And it is present in environment. It floats in environment for lots of time. The transmission also depends upon the air currents, use of fans or the wind current if it is an open space. So, these droplet precautions are to be observed when such droplets, they arise in a ward or in a hospital setup. For example, these things are to be understood when you are dealing with pertussis, influenza, meningococcus meningitis, as well as the coronavirus. Okay. What are the precautionary details? That you have to use private rooms as far as possible. Do not allow any other person to enter into that room. A separate individual isolation rooms have to be used for such pathogens, and surgical mask if anyone is near to that patient, including nursing staff, doctors, or visitors, relatives. They have to use surgical mask N95 if they are within 1 meter of a patient. I hope this is very clear in the present context. Another important thing in prevention of infection in hospital environment is the segregation of waste. For effective segregation of waste, one should make the arrangement for different types of containers, waste containers, in all clinical areas of the hospital. Clinical areas of the hospital means in wards and if possible near the bed of a patient, in operation theatres, in a general ward, and even in toilets and bathrooms. So these containers, they have to be very much labeled properly, should have different color codes if necessary, and has to be properly placed so that it is visible to every individual. And the staff, persons associated should be briefed, should be educated to use different containers for different kinds of waste. For example, sharp containers where you can use needles, other sharp materials which has been used for inspection or a treatment of the patient. Second one is infectious waste bin, which would have the body fluids, the tissues, biopsies, or vomits, or urine, or stool passed by a person. It also includes dressings and bandages from a patient, as well as regular waste bin, where normal waste materials are to be thrown. So it is necessary to have a segregation of the waste, different bins or containers for different types of waste. This is a diagram which shows the effective hand washing. You have to practice it thoroughly. Nursing staff has to understand that hand washing is not a routine hand washing which you tell anybody and he would do it. It has to be thoroughly taught. As you can see here, first one is you have to moisten your hands, followed by take soap and water, then use both the hands to rub that soap and water on your hands, followed by taking a little bit of water and again making foams. See that each and every nooks and corners of your hands, palms, the upper surface of the palm, forearm, then your places in between your fingers, your nails like this, you have to scrub them. You have to use thumbs also to clean them. You have to clean the thumbs like this alternatively. And finally, wash them with turning tape water. Finally, use clean towels to clean your hands, or even you can use a special instrument where a hot air flow will be there and you can dry your hands. So this is how effective hand washing is to be done. Remember, never forget, simple washing would save many lives. And this has been going on since centuries, since the time of Ignaz Semmelweis, as I have told you the story. Till now, it is to be practiced. So this is about how to prevent the washing of hands in our healthcare practices. For this PowerPoint presentations, I am highly thankful to the program created for schedule of training modules at Travancore Medical College as a part of infection control program organized by Infection Control, and this was created by Dr. T.V. Rao for benefits of nursing staff in healthcare. I highly acknowledge these use of the PowerPoint presentations. So thank you very much.